There's a case fatality rate of 2.1, still much higher than we would have wanted. When we look at the last 1 week, that is epidemiological week 4, and compare it to epi week 3, we document 6,371 new cases here in Africa, which is a 17% increase from the previous week, which had just over 5,000 cases. When we look at the same period, epi week 4 and 3, we document 28 new, and this is a 10% decrease over epi week 3, which had 31 deaths. Looking at the trend for the past 4 weeks, there has on average been a 5% increase in the number of new cases on the continent. And in terms of deaths, we have seen a 19% increase as well. These numbers are relatively stable, and we at the moment do not see any spikes in any country or region, indeed, on the continent. For vaccination, of the 1.079 billion doses for COVID-19 vaccines that we have received, we have administered a total of 898 million, which gives us an administration of about 83%. In terms of coverage for COVID-19, fully vaccinated individuals account for 43.9% of the target population, And this is over 407 million people being fully vaccinated on the continent. Indeed, since the last briefing, 4 million additional people have been vaccinated, fully vaccinated against COVID-19. Boosters are also continued to be administered, and as of today, we have 4.7% coverage for booster doses, which translates to just over 45 million people having been administered booster doses. In the last 1 week, over 300,000 additional people have received their booster doses. We have 14 member states that have reached the 70% fully vaccinated of the population, and we continue to work with others to bring them to this same level. We continue to encourage our member states to use all means that work within their own communities to get more people to get vaccinated, whether it is targeted vaccination, or whether it is integrating into the usual vaccination, regular vaccination, or whether it is campaigns for COVID-19 vaccination. We encourage every means to be used to continue to increase the continent's fully vaccinated people, and therefore minimize the risks related to COVID-19, because the virus indeed is still circulating. For our Saving Lives and Livelihoods program, we continue to be actively implementing in 19 countries, and we have begun some level of work with 49 countries in total, but 19 is where we are actively implementing the COVID-19 vaccination under the Saving Lives and Livelihoods program. To date, we have administered about 11.8 million doses under the Saving Lives and Livelihoods program, and over the last 1 week, an additional 96,000 vaccines doses were delivered through this particular program. So this is COVID-19. Next is Mpox outbreak here on the continent, which is multi-country in nature. Since the last briefing, we have had 12 new confirmed cases and no new deaths. This is an 80% decrease in the number of new confirmed cases that are for AP week 4 compared to AP week 3. Since the beginning of this year, a total of 71 confirmed cases and 23 deaths as a result of Mpox have been reported from the DRC, from Ghana, from Liberia, and from Nigeria. And this gives us a very high case fatality rate of 32.4% so far for 2023. It's worth noting that the DRC and Nigeria are still accounting for over 90% of the reported confirmed cases for Mpox, but for all the other countries, we continue to work with them to keep the risks low and to manage those who have been exposed to this particular virus. The third public health event of significant concern is cholera. Since the last briefing, an additional 27 cases have been documented, including 89 new deaths. And these new cases and deaths have been reported from Kenya, Malawi, Mozambique, and Zambia. So 4 countries are reporting new cases of cholera during this last AP week 4. Cumulatively, though, from the beginning of the outbreak, we have seen 27,300 cases with 678 deaths, giving us a case fatality rate of 3.1% for cholera from member states beginning of 2023. Unfortunately, we are seeing the number of countries increasing during 2023. And we are working with these countries to ensure that we contain as is possible. Indeed, today I want to focus on 3 countries, and to focus first on Kenya, where we see that the first cases were reported in October 2022 in one county. We see progressively that more counties have actually been involved. And right now we have 6 of Kenyan counties that are reporting the cholera outbreak. In Kenya, cumulatively, 4,431 cases have been reported with 83 deaths. The second country I'd like to focus on is Malawi. Since the last update, Malawi has reported an additional 3,677 new cases and 111 new deaths, giving us a case fatality rate of 3%. This is a seize of the number of new cases compared to the last briefing. We also see that in Malawi, 29 districts are affected, and we are working with the government to get as many districts to control this cholera outbreak as is possible. And we are watching very closely the resurgence of cases, even when control measures have been instituted. And so we are on the ground in Malawi, supporting the government there in bringing this outbreak of cholera under control. Third country is Zambia. On the 26th of January, Zambia reported an outbreak of cholera in one district. And this one district shares a common border with both Malawi and Mozambique. And so as we continue to study this particular outbreak in Zambia, we do note that it shares a border with Malawi. To date, Zambia has reported 25 cases and 1 death. 2 of the confirmed cases have been confirmed to have had a history of travel to both Malawi and Mozambique. And so this can very well be a case of cross-border transmission. And that's why it is very important that in our response, we continue to work with neighboring countries to ensure heightened surveillance and preparedness with the relevant health countermeasures. So when we look at the affected member states that we are focused on today, and that is Kenya, Malawi, and Zambia, it is clear that when we put measures in place for improved hygiene and improved sources of clean water, then the cholera cases go down. And this is very classic for cholera. And that is what we are working to do, to expand actually in terms of doing in countries, particularly Malawi, but also Zambia, Kenya, and Mozambique. We are at the moment, apart from the team that we have deployed in Malawi, we are working very closely with the governments of the countries that are surrounding Malawi so that we can be able to have very good cross-border communication and cross-border surveillance to avoid any spillover of this particular outbreak. The fourth public health event that I'll report today is on Lassa fever. Since last week, when you look at Epi Week 3 and Epi Week 4 now, Nigeria has reported 109 new cases and 30 new deaths as a result of Lassa fever. And this is a 32% increase in the number of new cases and an over 300% increase in the number of new deaths. It is clearly a concern at the escalation in deaths as well as the escalation in the number of cases for Lassa fever that are being confirmed in Nigeria. We see that this is usually the high transmission period for Lassa fever in Nigeria. That is the period between December and April during the dry season. We are working together with the Nigerian authorities to bring this particular spike in transmission under control as soon as possible. The fifth that I want to report on today is Tropical Storm Cheneso in Madagascar. On the 19th of January, the Madagascar authority, the Malagasy authorities reported the landfall of Tropical Storm Cheneso in the central and northern parts of the country. And to date, a total of 34,100 persons have been displaced and 33 deaths have been reported across Madagascar as a result of the landfall of Tropical Storm Cheneso. In addition, over 13,350 houses, 18 medical centers, 100 classrooms, and numerous roads have been damaged in the affected regions. This, of course, complicates our response activities and also complicates how we can be able to be on the ground quickly because access has been hampered in those affected regions. Of course, the risks also increase when water mixes with sewage, and we are trying to work with the government of Madagascar to ensure that we bring this under control as soon as possible. Finally, is an announcement that we have now released to the press, the appointment of the 5 Africa CDC Youth Advisory Team for Health, and it is up on our website. They are 5 young people, 2 male, 3 female, from Cameroon, Uganda, Egypt, Malawi, and Ghana. And you will see in the press release their roles in strengthening our engagement with members of the youth across the continent. And we are looking forward to them contributing to Africa CDC's mandate and work here on the continent in the coming 12 months. Thank you, and back to you.
Thank you very much, Ahmed, and congratulations, 6th anniversary of the Africa CDC. All right, colleagues, we have come to the point where we take your questions and provide the answers for you, but I do not see any questions that have come through as yet. I'm also just checking on our WhatsApp. I'm not seeing any questions, and there is nothing. All right, I've just seen a hand that has gone up, and that is Esther. Esther, good morning. Please go ahead. Hello, Esther.
Good morning. Sorry, my microphone wasn't unmuted. Good morning. Thank you so much, Winnie, and thank you, Dr. Ahmed, and Happy New Year to you both. My question is about the cholera outbreak that is happening, and I just want to understand if what is the situation about the vaccines being availed in these countries. I have heard that these countries are looking for vaccines to use as an intervention into the situation, but I didn't hear Dr. Ahmed mention that this is one of the priority areas. Thank you.
Thank you very much, Esther, and compliments of the season to you as well. Vaccines are one of the tools that we use in responding to a cholera outbreak. And as you may know, we have currently a shortage globally of the cholera vaccine. Those that we secure are provided to countries, but at the moment, the countries that are responding, they not have immediate access to vaccines due to that shortage. And we are working with Gavi and WHO to make those available as soon as possible. However, it is not the only tool. We have other tools, public health nature, clean water, safe sanitation and environment, knowledge to the communities. All these tools come to bear, and vaccines are really in addition to the public health measures that we need to take. And very often, as soon as you control your source of water to be clean, as soon as you control your environment to be good in terms of public health sanitation, then the numbers progressively come down, even as we continue to secure and deliver vaccines across the continent where it is needed. It is not the only tool. Others are in play, and we are looking forward to all these other tools contributing to bringing this outbreak across these many countries under control as soon as possible.
All right, thank you, Ahmed. We have a question that's coming in from Jerving, who is with DEVEX. But before I give you that question, colleagues, I just want to let you know that this brief day will be a bit shorter than our ones, and it will last for 45 minutes. So please, if you do have questions, kindly just send them through right away. So Sarah says, do you have any updates on the unknown flu-like virus that is affecting African citizens in China?
Thank you, Sarah. No, we still do not have a definitive diagnosis, and we continue to work closely with our colleagues in China CDC to bring this matter to conclusion. So not yet identified conclusively what that flu-like illness actually is amongst those who are affected. And we still also do not have any local transmission, which is amongst the local Chinese population, which is a good thing. And we are also hoping that this outbreak is going to be under control in a short while.
All right, thank you. It seems like we are done with the questions for today because I'm not seeing anything else coming up. Okay, we really don't have any more questions. So perhaps it is time for us to have your critical points, your 3 critical or 4 that you like colleagues to take away from our briefing today.
No, thank you, Wayne. And the 3 things I would like to end with today. Number 1 is cholera. Cholera is preventable. Indeed, it is treatable when it does occur. Our preference is that it does not occur at all. Our appeal to members of the public is that during the season of high risk for cholera, we urge members of the public to follow the direction and advice that comes from the ministries of health so that we can all stay safe. We don't want it to spread beyond where it has reached today. Secondly is COVID. We still have a distance to go in as far as vaccination for COVID is concerned. Get your COVID-19 shot, and if you're eligible, please get your booster so that your risks are reduced, and in that way, you and those around you are better protected against COVID. Third is a really big thank you to you as journalists and members of the public who, in a very dedicated manner, are joining us every week for these press briefings, engaging with us even beyond briefing. You have contributed to the 6 years of success that Africa CDC has enjoyed, and we ask you to continue engaging, supporting our work so that Africa CDC can be able to deliver even more in the coming year. We don't have time to celebrate as such because we have so many outbreaks going on the continent, but on our behalf, do take time off, get yourself a good, clean glass of water and enjoy with us as we commemorate the 6 years of Africa CDC to date. And back to you, Wayne.
Right.
Thank you very much.
All right. Unfortunately, Kara Anna has just come in with a question, which I think we can squeeze in before we say goodbye. And Kara Anna is with the Associated Press, and she says, "Thank you for the briefing. What does it mean when you say that countries with cholera outbreaks do not have immediate access to vaccines? They have no access to vaccines at all, or is there some other delay? And how long would this delay be?"
Thank you, Kara. Essentially, the problem is there is more demand than we are producing cholera vaccines. There are limited facilities that actually manufacture cholera vaccines. And because of the challenges that globally we've been facing, particularly in Asia, Pakistan in particularly, and here in Africa, the demand for cholera vaccines has multiplied over the last 6 or so months. This huge demand has meant that the capacity globally that we have for producing vaccines is overwhelmed, overstretched. And that is why the countries do not have access to cholera vaccines as they would have wanted, because the numbers are being distributed as manufactured, and the manufacturing capacity of the world is not able to cope with the current demand. Which takes us to the conversation around local manufacturing. We are working with at least 2 manufacturers now to see if we can be able to repurpose facilities to manufacture cholera vaccines here on the continent of Africa. And as those discussions get completed, we'll be sharing as well. The problem is production is not keeping up with demand. Thank you.
All right. It seems like the tap has just opened. The floodgates have opened for the questions. Esther Nakazi comes with a follow-up question, and she says, "What is the price of a cholera vaccine?"
Esther, to be frank, I don't know what the unit price actually is, but we can be able to figure that out and let you know. And the reason is Gavi usually buys them in bulk, and we focus on access rather than purchase of these vaccines. But we will get you a figure to give you a more specific answer to that.
Okay, thanks, Ahmed. We have someone called Franklin Wirsi who has his hand up. Franklin, can you start by telling us your news agency and then ask your question?
Thank you very much.
Yes, please tell us your news agency.
Dr. Franklin Wirsi, one of the, I'm not a journalist, but one of the team member that has been nominated and selected. I just wanted to use this opportunity to thank Dr. Ahmed. We're told about this meeting and that indeed the youth voices are being considered and that we're looking forward to work together to achieve the new public health order of Africa. That is it. Thank you.
All right. I think Dr. Ahmed had already given us his closing remarks. I'm not seeing anyone else requesting the floor. So I take it that this brings our briefing today to an end. So we'll meet again on Thursday next week at the same time, which is 12 noon East African time. Thank you for your time for today. Bye-bye.
Thank you.